OSA, obstructive sleep apnea, OSA. This disorder is characterized by intermittent closure or collapse of the pharyngeal airway, which causes apneic episodes during sleep. These are terminated by partial arousal. Sleep apnea. By convention, sleep apnea is defined as breath cessation for at least 10 seconds. It was given by American Academy of Sleep Medicine. Most patients with sleep apnea have a cessation of 20 to 30 seconds. The duration of cessation may be as long as 2 to 3 minutes, but cutoff is 10 seconds so that we can squeeze in a lot of people into the criteria to do research. Sleep apneas can be central or can be obstructive. OSA, that is obstructive sleep apnea, is the most common disorder which causes daytime sleepiness, impairs daily function, and is severe during REM sleep, rapid eye movement sleep, when neuromuscular output of the skeletal muscle is particularly low and in supine position due to gravitational force. Types: central and obstructive. Central sleep apnea. In pure central sleep apnea, the brain's respiratory control centers located in the pre-Butzinger complex are imbalanced during sleep and fail to give the signal to inhale, causing the individual to miss one or more cycles of breathing. So the person will forget to inhale. The brain forgets to tell the person to inhale. So the person forgets to breathe. That's what happens in central sleep apnea, and the problem is in the pre-Butzinger complex. The neurological feedback mechanism that monitors the blood levels of carbon dioxide and in turn stimulates the respiration fails to react quickly enough to maintain an even respiratory rate, allowing the entire respiratory system to cycle between apnea and hypopnea, even for a brief time following an awakening during a breathing pause. Neurological feedback mechanism, which monitors the blood level of CO2, will stimulate the respiration and then it maintains the respiratory rate. So hypopnea, apnea வந்து ஃபாஸ்ட்டாக நடக்கும். Sleeper stops breathing for 2 minutes and then starts breathing again. There is no effort made to breathe during the pause in breathing. There is no chest movements, there is no muscle struggling. Although when awakening occurs in the middle of a pause, the inability to immediately operate the breathing muscles often results in cognitive struggle accompanied by feeling of panic exacerbated with the feeling of excessive blood CO2 levels. Chain stroke respiration is seen in central sleep apnea. Okay, so that was about central sleep apnea. Pre-Butzinger complex fails to tell the person to breathe. So the person misses a few cycles of breathing. So the person will be sleeping for up to 2 minutes without any sign of respiration, no sign of respiratory struggle. Although during this pause, the person wakes up, the person is going to become so confused and anxiety. And because of CO2 retention, there could be clinical features too. Chain stroke breathing is seen in case of central sleep apnea. Obstructive sleep apnea occurs due to transient occlusion of the oropharyngeal airway despite the continued respiratory drive. Clinical features: a typical patient is obese middle-aged man or a postmenopausal woman who presents because of snoring or daytime somnolence. Poor sleep quality will reduce the cognitive performance, morning headache, and decrease libido. Complications include type 2 respiratory failure and pulmonary hypertension. Investigations are polysomnography. It monitors the O2 sats, ECG, EMG, airflow at the nose and the mouth, chest and abdominal wall movement during sleep. Okay, so these are the whole things about the investigation of say polysomnography. Polysomnography will tell the oxygen saturation, ECG, EMG, electrocardiography, electromyography, airway flow in the nose, airway flow in the mouth, chest and abdominal wall movement during sleep. That was about polysomnography. So, okay, that's about the OSA, obstructive sleep apnea. But apart from that, management is there. Management includes weight reduction, avoidance of smoking, tobacco, and alcohol, CPAP via a nasal mask during sleep, surgical procedure to relieve the obstruction to the pharynx like tonsillectomy, uveopalatopharyngoplasty, tracheostomy, weight reduction, smoking, alcohol cessation, CPAP, surgery. So, yes, okay. Collapse or closure of the pharyngeal airway is OSA. Thank you.